countries are shrinking. Japan will shrink by 16% by 2050, Italy by 12%, Germany by 5%. China's going to shrink. India's already become the most populated countries. So you'll have, shrinking countries, but you'll also have a shift in the age distribution as well because we have increased life expectancy. So you have a total shift in the population composition as well.
Hello and welcome to this edition of the IFS Zooms In. I'm Paul Johnson, Director of the Institute for Fiscal Studies, and this week we're looking at something which is possibly among the most important things that we'll ever look at, which is demography. What's happening to the size of the population, the age of the population, what's happening to fertility, mortality, immigration? What could matter more? At the end of October, the Office of National Statistics announced that the fertility rate in England and Wales had fallen to 1.44 births per woman in 2023. That's the lowest figure since records began in 1938 and well below the number of children that we need to have to maintain the size of the population, unless, of course, we have large amounts of inward migration. So what will this mean for the population makeup of the country? Why is this trend actually occurring across most of the developed world? What will its implications be? Very IFS question on the public finances and indeed on the economy, as we'll have seen just in the Office of Budget Responsibility report on the budget last week. High-ish levels of immigration are actually quite important to their views about the growth of the economy and the public finances. So to discuss these questions, I'm joined by Melinda Mills, who is Director of the Leverhulme Centre for Demographic Science and Nuffield Professor of Demography at the University of Oxford. Welcome, Melinda. And by Carl Emmerson, who is Deputy Director here at the IFS and one of the leading experts, not just on the UK's public finances, but also on the pension system. So let's start, Melinda, with that extraordinary figure on birth rates. It's fallen to 1.44 births per woman, as I said. That's quite a swift slowdown, isn't it, over the last relatively small number of years. What's actually been going on with birth rates over recent decades?
Yeah, so thank you for having me. I think if we look at the UK, so this is, as you said, it's the lowest birth rate that the UK has had on record. So since the 1930s, for the last 80 years. And just to put it into perspective, it was around 2.2 in the 1950s. So that's quite a drop. And then it dropped to just under 2 in the 1980s. So this means that we're not replacing ourselves in terms of fertility. And if you put it into perspective, there's other countries that started to have lower fertility much earlier. So if we think of Italy and Spain, they were down to 1.2. In South Korea, of course, is down to 0.7. So there's some countries and areas in the world that have had very low fertility and sustained low fertility for a long time. Countries such as China are also experiencing these changes. So it's really a shift that the UK is following many other countries. The US as well, a country that's traditionally had very high fertility for a sustained period of time, is also now, to 1.78. So this is a general shift across many countries.
And am I right that it's fallen just in the last few years, last 5 or 10 years in the UK to get to this level of 1.44?
Yeah, so what's interesting is it's fallen in the UK and it's fallen across different regions. But what's happened more recently, there was a study that came out a few years ago that showed that it wasn't just dropping in the highest educated groups. So this often happens earlier in a lot of Western societies and East Asian societies, that you have it dropping in relation to education. But the real difference is it's the lower educated groups, and that's where it's starting to drop. And that's why you get, at least in the last years, this decrease in fertility. And that's related to, economic uncertainty, zero-hour contracts, housing, a lot of other issues and economic uncertainty. That's when it gets tied to different groups. So I think that's the primary reason for the shift in the UK for the last years.
So your view is it's driven very much by the economics, that it's becoming increasingly difficult and expensive to manage financially.
Yeah, so there's been quite a few studies that have looked at, what are the reasons of why we have this. Part of it is things such as economic precarity, and people, for example, they need to think about long-term planning when you have children. So you have to think about things like fixed-term mortgages. Can I get housing? Will it be available? Does my job have a long enough horizon that I'd be able to plan to have children? What about childcare costs? All of these things are really important, and people think about these things. So as well, too, women are entering into the labor market. They're getting higher education. They're staying in the labor market. And what they're doing as well is they're postponing births. So we might still have a catch up. The other thing that was stated in the ONS report that was released in October was that we have record postponements of births. So women are having, on average, births around the age of 31, and men are having them at the average age of 33.8. So this is also lower. So we might have a bit of a catch up. But, we also have issues that once you start moving and postponing births, there's biology comes to play. And so people aren't able to have as many children as they expected. So there's lots of sort of pushing reasons. So it's economic uncertainty, it's housing, it's education, it's ability to find a partner, and structural aspects such as childcare.
People often refer to this or talk about this in the UK context. We've got very expensive housing, and that makes having children expensive, and very expensive childcare. But as you were saying, this is by no means a uniquely British phenomenon. Indeed, we're a little bit behind many other countries in the drop in our birth rates. And so those explanations about particularly English or British high levels of housing costs, or particularly British high levels of childcare costs, presumably aren't really the explanation.
No, certainly those are reasons across multiple countries. So those kind of reasons that we're just talking about housing, about uncertainty in the labor market, economic uncertainty, childcare, those are all issues that the low fertility societies are all experiencing. So, the question is, what can you do? And I guess before we get into that, so what sort of impacts does that have as well, too? So we have, countries are shrinking. So there's many countries such as, Japan will shrink by 16% by 2050, Italy by 12%, Germany by 5%, China's going to shrink. India's already become the most populated countries. So you'll have, shrinking countries, but you'll also have a shift in the age distribution as well, too, because we have increased life expectancy. So you have a total shift in the population composition as well, too.
We're not shrinking, are we? And we're not shrinking because we've got historically high levels of immigration. I mean, can one think of that as a response to a low birth rate? Can one think of that as an answer to how we should respond to low birth rates?
Yeah, so in demography, we think about, overall population composition in terms of births, deaths, and migration, and how that relates to population growth. So the UK actually had a 1% annual increase in its population in 2024. And if you think about that, France had a 0.3, Germany 0.7, Italy was minus 0.3. So the UK has definitely managed to sustain its population levels by immigration. And, as we know, we've had some of the highest levels of immigration in the last years into the country. And those were largely related to work, but also international study as well, too. And many of those workers, if you follow the data and look into it, about 33% of reasons to immigrate in 2023 to the UK was for work, and many of those people are in the healthcare sector. So as you get an older population, you have strains on the healthcare sector, and you need those migrants. So that's the problem that some East Asian countries are having, such as South Korea, that don't have favorable immigration policies and an extremely aging population, and as well very low fertility. If you don't have that sort of population, who's going to sustain all of these different services in this older population?
How are those countries managing? I mean, it's hard to imagine, isn't it, a world in which, or a country in which the population is aging and shrinking at that rate.
Well, they're going into some serious issues. So South Korea, for example, I'm going to go there in November of 2024. They're bringing in lots of experts, the government, to again, deal with this. In May 2024, the president called a national emergency about this and is creating a ministry focused on pronatalist policies. They're spending billions on these pronatalist policies, and they've got one of the longest life expectancies in the world. It's about 84 years. So they're maintaining old age care is a real issue for them. But the issue is they've tried all sorts of things like cash bonuses, pronatalist policies, and there's some econometric analyses, showing, well, about 75% of the births would have happened anyway. So these cash transfers have proven to be quite impotent. And there's a lot of discussion, about these cash transfers or things related to the two-child tax limit, all of these issues. But they've shown not to really, the people that were going to have births perhaps have them quicker. And it really comes down to culture and gender equality, which is a difficult, there's no silver bullet or there's no cash amount that you can put towards that. So South Korea is really struggling because, it's really about a gender gap and unpaid care work. It's about, if you get married, you have to take care of your husband and your in-laws. It's those kind of issues that have proven, and really long work hours as well. And also children as well. It's very intensive sort of tiger parenting, they call it, and, very competitive education system. So it's really the pronatalist policies, the idea is that they probably shouldn't just focus on pronatalist things. They should focus on the education system, culture, and, all of these different aspects.
I guess those are all lessons and warnings for us when we think about everything, including our education system and expectations of women and children going forward.
So it's really an interconnected thing. So I think when we often think about these pronatalist policies or these demographic policies, it's really like housing, education, gender equality, and things. And if I can just add, if you think about the pronatalist policies, some of the things, do you know how much Hungary spends, what percentage of its GDP it currently spends on pronatalist policies? Do you have a guess?
I've got no idea. Go on, shock us.
5%.
Wow.
It spends currently 5% of its GDP on pronatalist policies. So, think about it. The UK, spends about 2.3% on defense. And, this is what they're spending. So it's extreme. So if women have more than 4 children, they don't have to pay any personal tax for the rest of their lives. They can take out loans. And once you get up to 4 children, your loan is waived. So, and it's not working, of course. So some countries are just desperate. And these are the kind of policies that they're introducing.
I've got 4 children. Maybe I should claim some in retrospect. Done my bit, I reckon. So Carl, this has all sorts of consequences. But being the Institute for Fiscal Studies, one of the things we're obviously interested in is the consequences for the public finances. And I suppose one level, we've got fewer children, we don't have to spend so much on education, but at a broader level, if our population is aging, then it's going to get harder and harder to look after people like me as I get older and older.
Yeah, I think it does very much depend on what kind of timescale you're looking at. And we've just heard that children are very expensive, as any parent knows. Under 20s are very expensive for the state. They don't typically pay very much in tax. If they're younger children, they typically receive quite a lot of healthcare, and of course, childcare support, and schools are not cheap either. So the best government estimate suggests that you're talking about £20,000 per year spent on those under 20 each, net of the tax that they pay, which is very little. So a falling birth rate over the next 5 to 20 years is going to give you a saving on the public finances.
Hurrah!
I think there's probably another challenge there, though, and I think probably for management of public services, it's probably much easier to deal with a stable population. It's probably quite a challenge if you have rising school population and a falling school population. If you've got 29 children in a primary school and suddenly that drops to 27, it's pretty difficult to make a kind of cash saving out of that. If the class size goes up from 27 to 31, you have a big problem because perhaps you need to build a new classroom as well as hiring a new teacher. So I think there's probably some efficiency costs from not having stability here. But of course, over the lifetime, you expect the public finance effects to balance out. It's working age people who are paying a lot more in tax than they're getting in public spending typically. And that should be sufficient to pay for both the older population who are retired and getting a lot of healthcare, and also that younger population who are using a lot of healthcare, and in particular using a lot of childcare and school education too.
But later on, if we're not replacing ourselves, then the population will presumably just age, and older people are even more expensive than children.
Well, I guess then it depends a bit on what kind of aging you have. Again, if you have a stable population, but people are just living, each cohort's the same size, but people are living longer at older ages. If they're living longer, healthier lives, then you might expect them to stay in paid work for a bit longer. It will put a little bit extra demand on public services, because everybody puts some demand on public services, but maybe not too much. And in that kind of world, it would just be perhaps the last few months and years of life that would put particular demands on the health system and the long-term care system. You'd just be pushing that back in time. Of course, you could tell a much worse story where people are living longer lives, but some of that extra years of life is in poor health. Perhaps they're not able to, if they live an extra year longer, perhaps they're not able to work that much longer. And perhaps they will put considerable more constraints on the healthcare system and the adult social care system. And then you do have that problem. Both you've got those extra costs, and also, as we were just hearing, you might have a problem about, well, who's providing that care? If you haven't got the children being born now, who's going to be the nurses, doctors, carers, etc. in 30, 40, 50 years' time?
Melinda, part of the answer to that seems to be we're getting immigrants in to do that kind of work. Is that sustainable in your view?
Well, you've had some countries such as Canada that has actually tried that via the point system, and they've brought in huge amounts compared to their population of immigrants coming in, and they've had one of the highest population growths, of Western countries, and that's actually in some ways backfired politically as well too, because there's been such sustained growth combined with humanitarian crises and things, so more people entering into the country and then not being able to actually find jobs. So it's turned into a huge political situation there as well too, and lots of discussion about that, and discussion about reskilling and about who's not in the labor force, and the same kind of things are happening here. But if I can just return to some of the things that Carl was talking about, that you were talking about, so what does this mean when you have this falling birth rates and this aging population? I think it has really, as you said, it's got really deep we have to think deeper about pensions and all of these different issues. But we also have to think very deeply about infrastructure as well too. So as Carl was mentioning as well too, you have these changes in education, and geographically who has children, it's different across the country as well too, across the UK. So you have this extreme shrinkage of people not having children in London, for example. So there's increasingly schools that are closing, or you have this drop in school numbers, but you still have to heat the building, and you still have some children there. So there's definitely some pressures there. There's been some creative thinking in some other countries, because sometimes it's related to postponement, and people will have children, and then if you close the school, then you have some issues there, or you have the new cohort, as Carl was saying, coming through that will have children. So should you close the school or not? So there's been some interesting sort of combined use purposes of combining schools and education with senior care, for example, or combining childcare with senior care. And there's a whole discussion, like it's about infrastructure and planning. So are children really being designed out of cities? If you think about new build, when the council houses get removed, new builds often are not 3-bedroom apartments, but 1-bedroom apartments. So there's a discussion, that they're getting built out of cities. So, it's all of these different issues, and it's about transport too. So you'll have to really shift sort of transportation. It's now, centered around schools and around workplaces. It might have to be centered more around hospitals and social care and care as well.
Again, coming back to this issue of how the population's likely to change over time. Do we have different levels of fertility among different ethnic groups or among immigrants relative to the native-born population?
Yeah, so that's really interesting if you look at it. And there's been quite a few studies. So, demographers have looked at it across many different countries to try to see. So the immigrant population is usually younger and of childbearing age. So they come, and sometimes they, depending on the group, they have higher fertility, but then generally they shift over, just like they do with health. They generally are, some of them are healthier as well than the native population, but they generally shift over and have similar fertility levels. So even though some of them may have come from high fertility settings, they often shift and have similar amounts of fertility and follow similar health patterns of the native population. So although that might be a solution in terms of labor market and working in the care sector, for example, it's not a long-term solution in terms of fertility replacement. So you really have to think, in things, as I was talking about before, about childcare and work, family balance, all of these kind of issues that really make people, able to have children if they want to have children.
So it sounds from what you're saying that if we want to change this picture, it's going to require quite a concerted effort across everything from housing to childcare to our education system, perhaps to maternity and paternity leave. It's not shiftable by the sound of it just by paying a bit extra to people who are having children. You need a societal strategy for this to be able to have any kind of shift.
Yeah, so I think that, we're going in November to South Korea and really, breaking down, and we've done this with other countries as well, sort of breaking down what are the issues related to low fertility. And there's been countless analyses of, that these cash incentives, will reach certain groups and they'll probably have children quicker. But there's been some interesting randomized control trials in Norway, for example, where they made childcare more local, more affordable, more available for people in one region compared to another. And if we look at these RCTs, it shows that that actually works. So people were able to have children. So there's definitely been some scientific studies. But to date, the ones on, if you're spending 5% of your GDP on pronatalist policies, and you have been for quite a few years, and your fertility rate goes down, probably not working. So as you said, it's really got to be joined up. It's got to be a different way of thinking. But I think the most difficult nut to crack too is things related to culture and norms and gender equality. So that's where some of the East Asian countries are really having difficulties. So, women are entering into the labor market and they want gender equality in the household. Whereas, if you look at the unpaid care studies in South Korea, women spend a lot more time. So men spend on average 17 minutes per day on unpaid care in comparison to women that spend, over an hour or more. So it's those kind of things, so sort of cultural norms that are difficult, but you have to enable them. So for example, long work hour cultures or paternity leave, you have to make it not just available, but acceptable as well, too. And that sometimes takes longer, but it really is joined up across different departments and ministries. So it's about education, it's about labor market, employment policies, it's about thinking about health, all of these different aspects. And that's what I think makes it difficult, because people just generally want like a tax incentive or, some sort of really clear silver bullet policy. And it just shows it hasn't worked.
Where do you think this is going in the UK? We're not at South Korean levels, but we're clearly at levels well below replacement rate. Is there any, if you had to forecast where we'll be in 5, 10, 15 years' time, do you think our fertility rate is now going to be stable? Is it going to get back up, or are we on an ever downward escalator?
Well, if you look at what the ONS predicted, so they predict by 2100 it'll be at 1.3. So the population predictions are that it will go down, but population
that's a long way out.
Yeah, that's a long way out, right? So, but population predictions are sort of like economic predictions. If I have to, so like a few things. So you have to make these assumptions about mortality and migration and fertility and all of these different things. But we've seen, so for example, the U.S. was going down, and now it's gone up again. So, you can see that a few things might change, and all these predictions are saying that Africa Africa will, be by 2100 also 54% of the births will happen in sub-Saharan Africa. But those don't take into account that, if education and women become more educated, the fertility rates in Africa may, substantially decrease as well too. So, the estimations of population differ across the UN and YASA, an Austrian group that does population predictions. It differs by about 2 billion. So these are like large standard deviations in your predictions. So a few things can happen. And I think, we've had a few technological surprises as well too, like these GLP-1, medications for anti-obesity and things. And that's sort of changing some of the health profiles in some countries. So this could really hit the UK as well. Like Carl was talking as well about the different morbidities and comorbidities and diseases that the UK and the US and some of those populations suffer from. So that there might be a few things that change as well too, that means our populations become healthier over time too. Maybe that's a really optimistic thing to say, but it's not just about aging populations. It's about how healthy they are too, and how much care they need.
And talking of long-term forecasts, Carl, the Office of Budget Responsibility does long-term forecasts of our public finances, and they tend to draw some fairly scary-looking charts in which debt sort of spirals ever upwards, largely related to their views about what's going to happen to the age structure of the population.
Yeah, what they do is they essentially look at how the population is forecast to age, and they assume that each age group will continue, each individual of each age will continue to get the same sort of spending as what we currently do relative to the size of the economy in terms of areas like health and social care. And then they sort of crank the handle on that, and they add in some assumptions about how productivity growth in those areas might lag behind that of the economy as a whole, because historically it's been harder to eke out productivity improvements in very labour-intensive industries. And then you can do projections of spending on things like the state pension as well. And it's certainly the case that the UK's spending as a share of GDP is forecast to increase pretty dramatically over the next 50 years. So we're currently spending about 42% of GDP on public spending, and the OBR's sort of central scenario has that going up to 60% by the mid-2070s. There are some areas of spending where they think spending will go down, so working age benefits.
So just from 42% to 60%.
Yeah, a huge increase.
It's colossal.
And it's actually the effect of, as I was going to say, that some spending in some areas coming down, so working age welfare comes down, public service pension spending comes down because of reforms implemented in the last 20 years. An increase in spending on the state pension, partly fueled by the triple lock, as well as the aging of the population. So I think there, if we replaced the triple lock with something a bit smarter, and we continued the policy of pushing up the state pension age as people live longer, we can deal with that pressure. And then where the pressure is absolutely huge is with our healthcare system and our adult social care system. That's where the spending growth is really, really very big. And that's where we need to think about how can we get a more productive system. That's where we need to think about what are we prepared to pay for going forwards. And I think that's probably the area where the UK is more exposed than other countries. Our state pension is not that generous compared to most countries' system, but the state is very involved in the delivery of healthcare. And if anything, the NHS seems to be spending more on older people than we see in other countries' systems. So we seem a bit more exposed to the kind of healthcare cost risk.
I think that's really the key here too. So if you think about the triple lock, I agree there will be some rethinking about that, but also just the state pension age. So we've seen this sort of gradual rise to 67 for those born in 1960, and then going up to age 68 between 2044 and 2046. Now the question is, do we have to move earlier for that? So if we look at the life expectancies and sort of healthy life expectancy as well, too, people are living much longer. So, the question is, could people work longer? And some other countries and areas have been looking at, people in relation to their health, but also in relation to their occupation as well. So, some people can work longer than others related to their occupation. But the question is this really sustainable to have these pension ages? What we haven't really talked about, well, Carl mentioned it, was social care and the health of the population. So I think that really, is one of the key factors. Is, people, they're living longer, but they're not necessarily living, healthier. So this focus on like early life prevention, health, all of these different aspects is key, because it's not just paying out pensions, but a huge amount of it is paid out on healthcare and support. So it's got to be rethinking that. And a lot of countries are facing that. But as Carl said as well too, the UK is I remember Andrew Dilnot talking about doing an interview, as he did for many years, repeatedly, over and over again, about social care. And he said, it's a lorry is about to come and hit us. It's coming towards us with this social care disaster. And I would tend to really, agree with him that, it's social care. This one, I didn't hear that much about it in the budget. So, and this is a really serious thing when you have this aging population. So it's not just about the pensions. It's really intertwined with the social care as well.
And on the state pension age, I think a remarkable fact is that at the moment, the share of the UK adult population who's above the state pension age is no higher than it was in 1975. So despite a big increase in longevity at older ages, the fact that the baby boomers were a big cohort moving through the 80s and 90s, and the fact that we've increased the state pension age substantially since 2010, so it's gone from 60 to 66 already for women and from 65 to 66 for men, has kept that proportion pretty constant over that period.
But that's and a lot of working age immigration.
And working age immigration. But going forwards, it is set to rise, which does, as Melinda say, raise the question about, should the planned increases occur a bit sooner than we're expecting? And will we be prepared to put up the state pension age further than the 68 that's currently legislated for the mid-2040s? Now, there'll be challenges as we keep pushing up the state pension age. Clearly, those people in ill health in their 60s will find it harder and harder to cope with. But I think it's also worth remembering that the proportion of men aged 64 in paid work was bigger in the mid-70s than it is today. So there is, in some sense, there is capacity amongst those groups to work.
Yeah, these are extraordinary statistics that Carl and colleagues have put together over the years. Clearly, a 64-year-old man now could expect to live, a decade longer than a 64-year-old man could have done in the 1970s. Certainly a lot longer. And yet they're less likely to be in work than was the case in the 1970s, but have much more life ahead of them. I just want to pick up on two things that the two of you have said. First, Melinda, yes, on social care. Actually, there was nothing in the budget, but it was the biggest announcement that Rachel Reeves made at the end of July, was that she was binning the last government social care reforms, the ones that Andrew Dilnot spent a decade or more of his life trying to get to happen, and that almost no coverage at the time. And it's something I've got annoyed about more than once on this podcast. But the other thing is this remarkable stability in the fraction of people over state pension age, which I said is partly driven by significant working age immigration. Again, what do we know about these working age immigrants? Do they tend to stay here and grow old with the rest of us? Do they tend to go home? Do we have to sort of keep running to keep still if we're relying on immigration to keep our population stable?
Yeah, so immigration, it's an interesting issue. So it's been reported, obviously, because of the related to elections, and the Conservatives had it as one of their main platforms as well too. And we had these like record inflows of 745,000 in 2022, so the estimates were that it was going to be a lot lower, around 200,000. so it's quite a difference. So the profile of these people that come in, I think it's related to a few issues. So it was a bit higher also because of the, humanitarian crises that we had as well too. So you had the refugees from Ukraine, so that increased the levels, and you had British nationals from Hong Kong as well. But, a lot of it was, as you were saying, about the recruiting for the labor market. So that was about just over 320,000. So 33% were for people coming to work, and about 39% to study. Now, the question is, and you said, okay, well, can this replace society? Well, remember, too, we have these higher salary requirements, so that makes it a little bit more difficult. And there was also, remember, the ban that was introduced on international students and care workers bringing family members. so that would inhibit fertility or having younger people as well, too. So these policies, you have to think about them in the longer term as well. And you see what happened during COVID as well, particularly in relation to Brexit, but also COVID, is a lot of Europeans went back to their home countries and didn't return. So there's an increasingly a discussion as well about making it attractive for immigrants to come and work and stay in your country. Now, depending on the country, some of them work and stay for longer, but remember there's these limits for students of how long you can stay and how much work you can do in particular countries. But, there's been lots of studies shown that, people, particularly once they become embedded and learn the language, that they can actually fill important positions and gaps in the labor market as well.
But there's clearly a sort of political issue here, isn't there? That high levels of immigration don't appear to be terribly popular, and yet you appeared almost to be suggesting that countries are actually almost competing with one another to get immigrants, or at least to get the right kind of immigrants, whereas internally to the country you've got increasing numbers of political parties or movements being very anti-immigration. This is a pretty hard thing for politicians to manage.
Yeah, this is it's a whole geopolitical discussion at the moment, too. So we've seen, shifts definitely across different countries. And it's really related to demography in many ways and related to migration. So if you think about the Netherlands and Geert Wilders and the Partij voor de Vrijheid, the Freedom Party, it's now, and that whole movement is very much based on immigration and linking it to household shortages. I was just in the U.S. as well, too. The U.S. elections are going on. Maybe by the time this is broadcast, we'll know the outcome. But it was very much based on reproductive rights, so fertility, and migration as well. Now, the question is, once these, and we've seen the AfD in Germany, we've seen Le Pen in France, all of these things get linked to exactly the things that I was talking about. So whether this increase in migration is related to housing shortages or transportation issues, this comes up repeatedly in the demographic discussions where it's related to immigration. And the question is, is it really empirically, once we look at it, are these housing shortages, are these job issues really, and inflation really related to migration? And it's hard to draw the causality there, but it's definitely used, as something politically that can polarize different populations. And it's tricky. So I was kind of doing more of a forecast about countries will be eventually competing for migrants than what I think is happening at the moment. I think it's, they're filling different labor market positions, but I wouldn't be surprised if in the coming period, once we, do get this hit for social care or caring for populations, that countries will be really thinking differently about how can we retain migrants to keep some of our services going.
Carl, one of the things that one sometimes hears from politicians is that there's lots and lots of British native people who are not in work, that we're currently bringing people in to fill jobs. We've got record numbers of people out of work because of disability and incapacity. And a lot of people don't have terribly high educational qualifications. Is there actually any scope for really increasing productivity and participation levels among those people who are already in the country, as opposed to relying on people from abroad?
Certainly right to point out that the number of working age individuals who are out of work and receiving an ill health benefit is both big and has increased dramatically since the summer of 2021. So if you could wave a magic wand and get those numbers back down to where they were 5 years ago, you would both make a direct public finance saving because you wouldn't be spending money on those ill health benefits, but you'd also have a much bigger pool of people for the labour market to draw on. That would be a big difference. So certainly there's scope in that sense. But of course, the challenge here is we don't fully understand why it is that we've seen such growth in the numbers of working age people moving on to these benefits. It's also occurred amongst children and pensioners too. To the extent to which they're in worse health, it's not going to be very easy to get them healthier or get them in a position where they can manage those health conditions better in order to be able to work. That's much easier said than done. So I think it's right that policymakers look at this area. There is potential there, but I don't think there's an area where there's going to be easy wins, and it's going to be an area where even if we put the right policies in place, it's going to take quite a long while to feed through.
And as you said, we've also, there's clearly, in some sense, scope for getting more people in their 60s into work, but either the labour market isn't friendly towards them, or actually there are a group who can afford to retire early and are happy to do so. I presume that group who can afford to retire early is going to dwindle over time as life expectancy rises and the old generous defined benefit pensions disappear and so on. But in terms of the sort of, for those of us of working age, this presumably all has implications for how much we need to save and how long we expect to be in work.
Well, certainly any kind of pension system is going to come under pressure when you've got people living longer. The pressures on the state pension system are perhaps quite obvious because you can see that you have perhaps the same number, maybe fewer workers paying into the tax pool, and you have retirees drawing on that pool for longer. But even in a private system, if it's some kind of defined benefit arrangement, then as we've seen in recent decades, they become much more expensive when people live longer in a way that wasn't anticipated, because they can all go and retire on a full pension at a set age and then just draw that pension for more years. Or they're in a defined contribution pension. That's essentially a savings pot. You pay money in, you invest it, hopefully it grows. When you get to retirement, if you retire, you've then got to manage that pot down. It requires, if you've got more years of retirement, it's going to mean more careful planning over a longer period. And if actually you retire at, say, the state pension age of 66 and you think you're in really good health and you think you're going to go for another 20 years, what happens if you get to 85 and you suddenly realise that you're probably going to go for another 10 years? The risk of running out is quite big too. Now, of course, in all of those arrangements, if you can come to a situation where people pay in for a bit longer, you get a double win because people pay into the scheme for longer and they draw on the scheme for less long too. So that can make quite a big difference to the calculations. So that's why increasing retirement ages, which isn't quite the same as just pushing up a state pension age, actually increasing the age at which people leave the labour market can make quite a big difference.
There may be things we need to do to make it easier or more worthwhile for people to do that. We ought to draw this to a close in a minute, but Melinda, two things have struck me about this. One is, actually, to a degree that even though I'd appreciated this was incredibly important, I mean, the extent to which this matters for virtually every kind of policy is becoming increasingly apparent in this discussion, both in terms of how we might change things, but also the effect that demography has on pretty much everything. But I just wonder what do we know about, we've talked about the impact on the economy and the public services and so on of changing fertility and the need for social care and all those sorts of things. What do we know, if anything, about how people feel about this? I mean, are women happier not having children or having fewer children? What's it like to grow old and not to have any children? Are people just as happy to be looked after by people who aren't their own kin, or indeed people who are from other countries? I mean, beyond the economics, we do think about it occasionally here, beyond the economics, beyond the public finances, is this a positive change in the sense that people are making these choices and this is an indication that, there's a group of people who are, not having kids, are enjoying life more, or is this a really constrained choice, and under different constraints, they'd actually be much happier with a different sort of demographic profile?
Yeah, it's a really good point. So, some of the reasons why we have lower fertility in these changing populations is, good news. We have gender equality, women entering into the labor market. We have longer life expectancies, people living longer. So it's not necessarily, bad news. But the question is, there's a huge amount of people that are also child-free. So not childless, but child-free, that have made that choice, that they, don't want to have children and they're able to live their lives. Now, the question is that a lot of old age care is related to family members. So this group increasingly that don't have children, which is 25%. In some places like Hong Kong, it's 35% of the population currently now, that have reached the end of their childbearing ages that won't have children. So that will take, thinking longer out, who will support them in terms of care, because actually family members do a lot of care. And we started to think about this, and I think we have to come back again to what you were talking about before in terms of health as well, too, of people that over time. So, is it that these people are child-free and they're voluntarily not wanting to have children, or are there some sort of medical or biological issues related here? So we looked at the entire population of Finland and as well of Sweden. So 33% of men who have reached the end of their childbearing ages don't have children anymore. So we thought, let's look at the population. This is really surprising. Are they child-free? Are they making this choice, or are there sort of medical issues? What's that? What's there? So we linked it to medical records and all of their health records from birth until their age of 55. And what we found, and I think this is really relevant for the UK as well, what we found is a lot of mental illness, a lot of substance use. So they weren't having partners, but they were also, really struggling. So we're just talking about people outside of the labor market. So I think we really increasingly have to look at these issues related to, we have higher levels of suicide. We've had deaths of despair, as they call it, in the US and in Scotland. So I think men are increasingly a really important issue, particularly young men, that we should start looking at as well, too, because we're seeing that, people maybe want to have children, but they're unable to. And then it becomes a problem.
You're not saying, I think, that because men aren't having the children, they're having these problems. I think, again, you're saying they're all interrelated. They've got the problems, they're not partnering, they're not having children, and all of that is resulting in this sort of level of unhappiness later in life.
Right. So it's related to, or even currently in life. So we were talking about the large amount of the population that's out of the labor market. Now that's for physical reasons, and it's also for mental health reasons. And these are all really legitimate reasons, but it's all woven up into something which we were seeing once we linked it to sort of hospital and medical records. It's linked up to many things about, there's certainty in your life. Can I get, just a basic thing, which they have that's standard in many countries and increasingly offered here, and people take the option, is like a fixed term mortgage. Like, what am I, what kind of certainty can I have, or a job path, or something like that. And people, when they're offered that more sort of certainty and stability, then they have this ability to look forward and plan out their lives as well, too. And I think it's those kind of joined up policies that are really important. And I think we often forget that mental health is a really large issue here and related to this. So we have to think about, how can people feel good about themselves? So, and then that's also part of the economy too. And then people will re-enter the labor market because they have some certainty, that they'll be able to do well and they'll be supported.
Yeah. And again, as you say, all very, very intimately linked. And the mental health results in partnership, results in certainty as a result of certainty, and is closely linked to fertility. Fascinating. We've already run, I think, well over the time that we were intending to spend on this, but that's been, I think listeners will agree, one of the, even by the standards of IFS Zooms In, one of the most interesting conversations that we've had, and maybe one that we ought to delve into more. As I said, it has become increasingly apparent to me just in the last less than an hour how important all of this is to everything that we think about here at the IFS whenever we're thinking about the public finances or public policy. And actually, when we think about public policy and the public finances, we should be thinking about its impact on demography as well. So, Melinda Mills, thank you so much for joining us for what's been an absolutely brilliant episode. Thank you, Carl, as well, for joining us once again. And thank you, everyone, for listening to this episode of the IFS Zooms In. To see more of our work, please do visit www.ifs.org.uk, and to further support us, please do consider becoming a member for as little as £10 a month. You can find out more in the episode description. We'll see you next time.